Today we're going to talk about cognitive enhancers. The concepts we're going to cover are when to use them, what the drugs do, their side effects, and how well they work. Why do you need to know? Well, someone might ask you.
Professor Lanctot, what exactly are cognitive enhancers?
Cognitive enhancers are medications that improve your cognition, your ability to think and to learn. They're grouped into two classes, cholinesterase inhibitors and NMDA antagonists. These medications are approved in Canada for use in Alzheimer's disease.
And what are the symptoms of Alzheimer's disease?
Alzheimer's disease impacts people in three different areas, A, B, and C. A stands for activities of daily living, B stands for behaviors, and C stands for cognitive impairment. In the early stages of Alzheimer's disease, tasks requiring sustained attention, memory, and problem-solving abilities begin to deteriorate. In the severe stages of Alzheimer's disease, patients exhibit loss of language, purposeful movement, and recognition. Cognitive deficits are closely tied with ability to function or activities of daily living. And almost all Alzheimer's disease patients will have behavioral problems like apathy, anxiety, agitation, or wandering.
But why do they have these symptoms?
Alzheimer's disease is a slow progressing disease that is not considered a part of normal aging. On a neuroanatomical level, it's characterized by loss of neurons or brain cells in important memory centers of the brain, thus causing these symptoms. These are structural brain scans of people with and without Alzheimer's disease. As you can see by comparing the top and bottom scans, Alzheimer's is associated with loss of brain tissue and eventually severe atrophy. Along with loss of brain tissue, there are disruptions in brain chemicals. These are images from a study that we conducted comparing individuals with Alzheimer's disease on the left to healthy controls. The image shows receptors for brain chemicals. The hotter the color, the more the receptors. Even when adjusting for loss of tissue, there are big differences between the two brains. Individuals with Alzheimer's disease have significant loss of receptors for brain chemicals.
Professor Lanctot, what do the medications do?
Good question. The first main pharmacologic approach is cholinesterase inhibitors. Cholinesterase inhibitors used include donepezil, rivastigmine, and galantamine, which are approved for the treatment of Alzheimer's disease. They aim to improve cognitive function through modulation of the brain chemical acetylcholine, or ACH. In patients with Alzheimer's disease, there's a reduction in the level of acetylcholine in the brain, and inhibition of the cholinesterase enzyme increases acetylcholine levels in the brain. Let's see how that works. Here is the presynaptic nerve terminal with cholinergic receptors designated M and N. Next, here is the postsynaptic nerve terminal. When acetylcholine is released, the enzyme acetylcholinesterase breaks it down into acetate and choline. By inhibiting that enzyme, you increase the amount of acetylcholine and its duration of action.
Do cholinesterase inhibitors work?
The number needed to treat to benefit is 7 for stabilization or improvement. That means for every 7 people treated, 1 is at least stabilized. These benefits include modest improvements in cognition, function, and behavior. For number needed to treat for side effects, 12 patients have to be treated before 1 has a drug-induced side effect, showing that more people benefit than not. The most common adverse events encountered with these cholinesterase inhibitors are gastrointestinal, like anorexia, nausea, vomiting, and diarrhea. They're dose-related and tend to be transient. Dizziness is another common adverse event. It's generally mild, transient, and unrelated to cardiovascular problems. Syncope or fainting, while rare, has been reported with these agents. These drugs have also been associated with sleep disturbances. The second pharmacologic approach is using the NMDA antagonist, memantine. It's approved for moderate to severe Alzheimer's disease. Excitotoxicity is the process by which nerve cells are damaged and killed by excessive stimulation by brain chemicals such as glutamate. Glutamate is the human brain's most prominent excitatory neurotransmitter. Memantine decreases excitotoxicity. Let's see how that works. Memantine is a low to moderate affinity NMDA antagonist or receptor blocker. It was specially designed to selectively block those excitotoxic effects associated with abnormal transmission of glutamate, but allow physiological transmission associated with normal cell functioning.
Professor Lanctot, does memantine work?
Well, the number needed to treat for benefit is 6 for stabilization or improvement. That means that for every 6 people treated with memantine, 1 is at least stabilized. Benefits include small improvements in cognition, function, and behavior. For number needed to treat for side effects, memantine was equivalent to placebo for numbers of patients with side effects, showing that it is remarkably well tolerated. Common side effects include diarrhea, dizziness, and headaches.
And will taking these drugs stop the progression of the illness?
There is currently no cure for Alzheimer's disease, and none of the available therapies will stop its eventual progression. Medications might help with the symptoms of dementia, but the impact for most people would be modest and temporary, with not everyone responding.
And Dr. Lanctot, what do the experts say?
According to Canadian consensus guidelines, all 3 cholinesterase inhibitors available in Canada are efficacious for mild to moderate Alzheimer's disease. They are all viable treatment options for most patients with mild to moderate Alzheimer's disease. In addition, for patients with moderate to severe Alzheimer's disease, they can be treated with cholinesterase inhibitors, memantine, or the combination. Expected benefits would include modest improvements in cognition, function, and behavior, and/or slower decline.
Thank you very much, Professor Lanctot. That was very helpful.
You're very welcome, Dr. Herman. Need a hand?
Yes, thank you. Oy.